Welcome to Peri-Op Talk. I'm Dr. Lisa Spruce, Senior Director of Evidence-Based Practice at AORN. And I am pleased to welcome Karen Decay, Senior Perioperative Practice Specialist, to discuss our guideline on surgical attire. Karen, welcome to the show.
Thank you, Lisa. Thank you so much for having me today. I'm so excited to share the updates to the surgical attire guideline because these updated recommendations can actually prevent the introduction of potential pathogens from surgical attire, ID badges, access cards, and personal communication devices from being introduced into the perioperative environment.
Welcome to Peri-Op Talk, making surgery safer one podcast at a time, with brief, practical information for you to take back to the OR.
So let's talk about some significant changes that we made this time around. And let's start with lanyards, because I know lanyards, there was some more research on that topic. So let's start with that. So tell us about what you added for lanyards.
Great. I think that's a great place to start. So there were basically one study and one case report that found lanyards contain pathogens and that the materials they were made of, mainly nylon and polyester, were really difficult to clean. So if I can expand a little bit on those two pieces of literature. The first is the study by Murphy and colleagues, and they actually cultured 108 lanyards from healthcare personnel and found that those lanyards, 26% of them contained the exact same species of Staph aureus that was in the nares of healthcare personnel. And so the researchers concluded that nasal bacteria is highly likely to be transferred from healthcare personnel's nares to their lanyards. And then the case report was actually regarding a shared lanyard that carried the drug access key. We remember those from a long time ago. And it was used by 2 ICUs, and it was actually found to be the source of a highly resistant fungi in both of those ICUs. And so even though this literature was low to moderate quality, we felt it important enough to share with our members and to also make a recommendation that an interdisciplinary team, again, composed of infection preventionists, perioperative personnel, anesthesia, and surgeons, look at whether or not they really want to use the lanyards in the perioperative area. And if they decide that is the case, that they really need to develop a process for cleaning and disinfection.
Yeah, that is not surprising at all that the research pointed to that. So, yeah, we definitely need to be looking out for those lanyards. So the other thing that we talk about frequently is cell phones and how completely not clean our cell phones are. So can you talk a little bit about the recommendations regarding cell phones?
Again, another great question, but let me start by asking you a question, Lisa. How many times a day do you think we contact our cell phones? Just throw out a number.
50, 100, a bunch.
Okay, well, there was actually an observational study that showed we touch our cell phones over 200 times a day. And each time we touch our cell phone, we shed skin cells, and these skin cells contain amino acids and minerals which can feed microorganisms. Then when you combine that with the heat generated from our cell phones, I know they can get quite warm, and any cracks or crevices that are present in the screen or the case, and we all have that, we really set up a perfect medium for microorganism growth. And so when you combine this one study with a number of other literature pieces that found microorganism growth on perioperative personnel's cell phones, we changed the recommendation from performing hand hygiene after initial cleaning of the cell phone to performing frequent hand hygiene when handling cell phones throughout the day.
Wow. Okay. Well, it's good to know.
It makes me want to clean my phone all the time.
Yeah, me too. And I know that we talk about, how to improve cleaning and disinfection of other things like our ID badges and like if we use access cards or even other personal electronic devices like our iPads or tablets or whatever that we're bringing in. Can you talk a little bit about cleaning and disinfection of those items?
Certainly. So this recent update provided a number of studies and case reports that cited interventions that were shown to increase buy-in and compliance with cleaning and disinfectant. And so we felt it important that we outline some of these strategies so that the cleaning and disinfection of those items can be improved. And those strategies included standardized processes that are integrated into daily workflow. Another one was that the necessary supplies, such as a disinfectant or a hand rub dispenser, be placed in easy access areas. So again, perioperative personnel don't have to go and hunt for those items. And this one I thought was also interesting, to develop reminders with clear instructions of how to clean and disinfect those items, and then putting them where they're visible for healthcare personnel. And then the last one I would say was to educate personnel on cross-contamination from these devices. And I thought one case study was interesting. What they did is they took a Petri dish and they had personnel put their cell phone, into the Petri dish, and right away you can see that organisms were growing. And then they had the healthcare personnel clean their cell phone and then put it back onto a new Petri dish, and there was minimal growth. So again, it's that old adage of seeing is believing. So I thought that was kind of a neat way to get that point across.
I love that. That's just some great interventions to do and to teach our nurses and perioperative teams on all that stuff. So that's great. Let's talk a little bit about any potential challenges in implementing these changes.
Yes, a couple come to mind. The first would be the formation of an interdisciplinary team to look at whether or not changing attire is necessary when being in other areas of the building. And then also that decision as to whether or not you're going to use lanyards. And I think this is a challenge because it's going to take time, coordination, and collaboration. And then the second one I would say is getting healthcare personnel to change their habits, particularly when it comes to frequent cleaning of those cell phones and then following through with a consistent cleaning and disinfection process of all of those items we talked about.
Yeah. Yeah. So how do you think healthcare facilities can effectively implement the updated Attire guidelines? What are your thoughts on that?
Yeah, great question. So I think if healthcare facilities take a comprehensive approach, and that comprehensive approach needs to include education, standardized processes, resource allocation, again, not only supplies, but the time to be able to, carry this out. And then probably continuous monitoring with that real-time feedback.
Yeah, great points. What do you think's the anticipated impact of these guidelines on patient outcomes?
Terrific question. So by implementing these updated guidelines, healthcare facilities can reduce the introduction of potential pathogens from surgical attire, lanyards, access keys, ID badges, personal communication devices, thereby minimizing the exposure of patients to these microorganisms that may contribute to SSIs. And although not new, I would say the recommendation to change surgical attire before leaving the facility at the end of the day will prevent the introduction of pathogens that may adhere to surgical attire during the workday from being introduced into public places such as our coffee shop or grocery store, or even being brought into the homes of perioperative personnel.
Karen, thanks for joining us today. It's just such great information about the surgical attire guideline.
It was a pleasure to be here. Thank you.
And thank you all for joining us today. We hope that this has been a helpful discussion about surgical attire. And this guideline is available in your eGuidelines Plus accounts and in your 2025 print guideline book and ebook. And that's it for today. See you again on Periop Talk.
Enjoyed the episode? Please like, comment, and subscribe. For additional Periop content, look for us on Instagram at AORN Pics and on Facebook and LinkedIn at AORN. You can also find us at aorn.org. Thanks for listening.